Welcome to the show. We are joined now by Dr. Scott Schultz from Bishop Eye Associates. It's so good to have you back.
Thanks for having me.
Now, we're going to be talking today about, obviously, eyes, but we're going to be talking glaucoma. Can you remind us a little bit about what exactly glaucoma is?
Absolutely. So glaucoma, it's an optic nerve disease. You know, it's very different than cataracts or other things that you might hear about, macular degeneration, things like that, where in glaucoma, the optic nerve itself, which is the cable that brings the images to your brain, gets damaged. And over time, the damage causes vision loss, usually in the peripheral vision over on the side. Most people don't know they have it. Most people don't know they're having any problems until sort of the end stages of glaucoma if it's not identified, but ultimately can cause blindness if it's not identified and treated. And so we take it very seriously. It's the third leading cause of blindness in the world. And so it's a very, very significant problem.
I was just going to ask how common it is.
Very common.
And how early on in its onset can you detect it?
Well, that's a good question. So we're looking more into that because the problem is you want to identify it first. You want to identify it early so you can get it treated. So more and more research is going into trying to identify glaucoma earlier and earlier and earlier in the process before you actually lose vision. And so at this point, you know, our technology is good enough where we can identify it really early in the disease process. And a lot of times, you know, people are called suspects or suspicious for glaucoma, even though all their testing is normal. Even they look suspicious on some of our things, and different tests and different examination techniques we use puts them at higher risk. So we watch them very, very closely, even before they have disease.
Yeah.
And so we're catching it earlier and earlier and earlier now, which is a good thing for the patients.
It is indeed, and this always goes back to our what we harp on all the time is your annual eye exam, how incredibly important that is. Now, when it comes to someone who has been diagnosed with glaucoma, what are the treatments?
Well, in general, there's a lot of different treatment theories, different modalities you can do. In general, you try to do the least invasive things first, going to the more invasive things. So typically you'd start off with eye drops, which aren't just artificial tears or stuff over the counter, but they're actually medicine. But instead of taking it by mouth, you have to use the eye drops to get the medicine directly to your eyes. What the problem is, pills don't generally work for glaucoma because the medicine that's absorbed into your body doesn't make its way to the eye. Very well. So the eye drops are usually the mainstay of treatment, at least initially, to get people started. And the goal of eye drops is really to lower the pressure. There's a lot that we don't know about glaucoma, honestly. There's a lot of research still going into it. So the only thing that we can treat with any of the modalities we use is the pressure, the eye pressure. So the pressure inside your eye. So it's not related to your blood pressure or anything like that. It's a totally separate thing. It's the pressure inside your eye. And in general, the higher the pressure is, the more stress it puts on the optic nerve, and that's what damages the optic nerve over time. Okay. At least that's the current thinking, the current theories, and current research indicates that. There's a lot of things about glaucoma that are pressure independent, meaning they don't have anything to do with the eye pressure, and that people are looking into those things and researching it and studying it to see if we can target other things with glaucoma to help the disease process. So currently, the only things we can do are lower the pressure. Start off with drops, eye drops. We can do a laser, actually, to lower the eye pressure, and that was, began about 10 or so years ago. Very, very successful treatment strategy, and works very well for patients. So it's a good option. A lot of times, in the recent years, last 5 or so years, people have been doing the laser actually first. Because it's so non-invasive, it's comfortable. Patients don't realize they've had it done. A lot of times they even forget they had it done. But it lowers the eye pressure without having to use a drop every day, having to use a drop. It's kind of annoying and nuisance sometimes. And it's necessary in a lot of cases, so that's okay. But if we can avoid having to use drops, we can. In a lot of cases, it's a good idea. So we do laser not infrequently, even first-line treatment. But some folks are just kind of, reluctant for laser. The word laser kind of scares some folks. Sure. Some folks it doesn't really matter. They like the idea. They think it's technology is better, and so we kind of tailor our treatment based on what the patient desires. Either way, as long as their pressure is managed, they're in good shape. So we can do laser at first. Once we do either drops or laser, if those things aren't working or if it's just not enough, sometimes the glaucoma continues to get worse even though we're doing these things. You have to do surgery. Which is the most invasive thing. It's very successful, but it has a higher risk of complication, a higher risk of just higher risk in general, and is more invasive. So you try to reserve that to more the end of the treatment paradigm. But So drops, laser, or surgery are basically the ways it's treated at this point.
Now, would you say that glaucoma is curable or reversible?
Neither. Currently, at least, there's no cure. And of course, just like everything else in medicine, we're looking for a cure. But also, like most things in medicine, there is no cure, at least right now. So the treatments are mainly focused at trying to preserve the vision, trying to keep it good, try to prevent it from getting worse, slow the process down, and things like that. So it's similar to kind of blood pressure and diabetes and all those other things. There's no cure, it's just a treatment. So if you're on blood pressure meds, if you're on cholesterol meds, if you're on, all these things, then it slows the process down, have a lower risk of having some complication from the disease in the future. So that's really what the treatment goals are. Cannot cure it, cannot reverse it. Which gets us back to your initial point about checking it early or catching it early. That's what you really want to do, because once you lose it, the vision's gone, you can't get it back. And so not infrequently I'll see somebody who never knew they had glaucoma because it's a painless disease. People don't really realize they have it unless they're getting checked, or they're aware of it because it runs in their family, something like that. But not infrequently I see somebody comes in the clinic who has really bad glaucoma and never knew it before, and then when you explain it to them, show them all these things, and they're realizing that they can't see as well as they used to, and it's from glaucoma, they're devastated because you can't get it back, you can't reverse it. And so identifying it early is really, really important, and a lot of research, like I said before, is going into trying to identify it early.
Sure. Now, what are some of the symptoms? Like, if you haven't had the early detection, or what are some of the symptoms that one might experience?
Well, there really aren't any symptoms. That's part of the problem.
You said it was asymptomatic.
Yeah, it's asymptomatic, so people don't feel it. Doesn't cause pain most of the time until the very end stages. You don't lose any vision that the patients perceive. That is, because it's all in the peripheral vision. The brain is kind of it's obviously a very complex and intricate organ.
Yeah.
And your visual pathways in the brain are such that you compensate. So even though one eye may have a lot of glaucoma, if the other eye doesn't, they compensate and overlap, and then the overall everything you see, your images that you see, are filled in, and your brain fills in those gaps very, very well.
That is so amazing about the eye.
A lot of people don't even realize they have a problem.
Yeah.
It's cool, but at the same time for these folks, it's not so good.
Right.
Because they don't know they have a problem.
Right.
But the good thing about it, about that in particular, is that people who even have mild to moderate glaucoma, they still function fine. They still have normal lives. They still do everything they want to do. Can still drive, no issues, because their brains and their eyes do that. So it's a very unique and very nice thing for them.
Sure.
Well, for everybody, that is.
Yeah. So I'm going to harp on it one more time. Early detection. Yeah. It is so incredibly important to have your annual eye exam. Yeah. Harping on it one more time. I'll be off my soapbox now. But just, that annual eye exam. So what's on the horizon for glaucoma treatment?
Well, there's a lot of different things that people are trying to do. So obviously, as I went through our sort of treatment strategies, least invasive to most invasive, surgery in some cases is really what is needed. And so we're trying to be less invasive with surgery. So one of the huge things that's being developed is micro or micro-invasive surgeries. And to try not to do as little as possible, but still get a desired effect. And so the traditional surgeries are, legitimate cutting knife surgery on the eye. It's a little scary, and they have complications. So the less you need to do, as long as you get a result, then you're good, because you have less risk. Less things can go wrong during surgery. It's tolerated better, and all these things. So it's a really beneficial thing. So that whole niche of surgery is being developed, and within that niche, there's all kinds of devices that are coming into play, which is really neat. From my standpoint, trying to help patients, is that it's a lot different than it used to be even 10 years ago.
Yeah.
These micro-invasive or mini-invasive surgeries have only really been around for the last less than 5 years, really. And in the mainstream, it's only been available for 2 years. The one called the iStent, for instance, was only just FDA approved 2 years ago, or maybe 3 years ago now.
What is that?
It's the smallest medical device ever approved to be used in a human body. The thing is tiny, tiny, tiny. You can probably fit like 100 of them on the head of a penny. They're tiny. And so what they're basically, if you blow it up and look at it, they're like a snorkel. They look like an L, like a snorkel-shaped thing where the L is a tube. And the inside of the tube is, the whole thing goes in your eye, but you snake it into the drain of the eye, inside. So then there's a direct conduit from the fluid that's in your eye to get into the natural drain so you can get back into your bloodstream. So ultimately the idea is what you're doing is you're bypassing the drain, which is diseased, which isn't functioning well in glaucoma, So if you can bypass it, the fluid can get directly in and go back in your bloodstream. But it's a microinvasive thing because you're not really changing the anatomy. Their anatomy is still unchanged. They just have a direct conduit. So you're really utilizing and maximizing their own drainage networks to function to their benefit, which are causing the problem. So we're trying to narrow down and really pinpoint where the problem is and bypass that instead of doing a big thing that isn't necessary.
Yeah.
So along those lines, it's the same thing. The iStent, there's a CyPass coming in, which is very, very similar kind of idea. There's an iStent Supra. There's all kinds of different drainage devices that are going in these mini invasive techniques, oftentimes through the same wound like that cataract surgery is done through. It's very, very small. They seal up on their own. You don't need stitches. Low risk of complications, all those things, doesn't change vision. So it's a really, really interesting and very new, exciting area that's being developed in glaucoma. So that's the surgical side. In terms of medicine, not everyone needs surgery, obviously. So medicine is still the mainstay. The vast majority of patients are still taking medicine for the glaucoma, and to try to find newer delivery systems. Because eye drops have their downfalls. It's hard for patients to use eye drops. It's not normal. People can take pills. They're used to it. They've been doing pills ever since they were a kid taking vitamins.
Right.
But by your eyes drops, people don't really use eye drops, and people are finicky about their eyes. I don't like my eyes touched. They can't do contacts, and they just don't want their eyes messed with. So putting an eye drop in every day, or even a couple times a day, is cumbersome.
Sure.
So trying to find a newer way that's easier for patients to use, that's more reliable, that lasts longer, and so they're looking at like a lot of different things. They're looking at like little depot devices that can actually be stuck inside the lid that people just forget about. You just put it inside your lid. It's there for 3 to 6 months. Never have to change it. Just don't worry about it. You don't feel it, and it elutes the medicine over time. Punctal plugs, where you stick a plug in the tear duct right here. It's a device that's been used for a long time for dry eyes. And someone finally said, well, what if we put some medicine in it? What would that work? And so people are trying that. Injections, actually, as scary as it sounds, injections for the eye have been around for a long time because people with macular degeneration, a lot of times if they're having any bleeding, they get injections on an almost monthly basis. And they're very successful, very low risk, and they're actually painless. As weird as that sounds, injections to the eye, if it's done correctly, is painless.
Absolutely painless.
So you can put glaucoma medicine in. And so people are looking at that. And then like contact lenses. I mean, even they're good at looking at contact lenses that go in the eye that elute the medicine too. So they're trying to find different ways that are just easier for patients. They don't have to worry about every day. You just do it, and it's good for a while instead of doing it multiple times a day.
Sure. Now, you all are on just the cutting edge of all of this technology at Bishop Eye Associates. Make sure you get your annual exam. What's the best way to get in touch with you all?
Call our office. You can look online, check out our website, and look at the doctors and things like that. Give us a call anytime.
Perfect.